Hello everyone, I am Dr. Priyanka Das, consultant gynecologist at Altius Hospitals. Welcome back to Altius Lilfeet. So today's topic is IUI, means Intrauterine Insemination. It will be explained to you in detail in the most simplified scientific language. Let's begin. IUI or Intrauterine Insemination. Intrauterine means inside the uterus, and insemination is injecting the sperms inside the uterus. So this procedure is one of the easiest process for a couple to conceive, much easier than IVF. So how does every cycle normal fertilization occurs? Every cycle, one egg is being selected and that egg goes into the fallopian tube. At the same time, when the husband and wife has intercourse, the sperms go up into the uterine cavity and in the fallopian tube fertilizes the selected ovum. That's how naturally pregnancy occurs. Now, in IUI, we tell the male partner to give his sample and we process it, and once the processing is done, the good quality of the sperms with good motility gets selected and we put them in the finest catheter and insert it into the uterine cavity. So what is the advantage here is that how normally the sperms get deposited into the vaginal canal in the posterior fornix. Sperms which are most washed, they will be put inside the uterine cavity. So half the distance is travelled. So the sperm with less potential, they need not travel all the way from the cervical canal into the uterine cavity, then fallopian tube. Half the path is done from the uterine cavity. This can be done in patient in whom there are no reason for infertility is explained. That we call it as unexplained infertility. If you have to understand, the hormonal levels are normal, the sperm is having good quality, still the couple is not able to conceive. In those cases, we suggest them IUI. Also in cases where the male partner is having below normal levels of sperm counts, mild oligohydramnias that we say, or the motility is not very good of the sperms, in those conditions, we suggest them to go ahead with IUI. The conditions where IUI should not be done, the main factor here for the fertilization to happen is the tubes, the fallopian tubes. So for this IUI to be successful, the fallopian tubes has to be patent. There should not be any blockage. So any woman with any infections of the fallopian tube, this procedure cannot be done. Also in women who are advanced maternal age, like more than 42 years, or in women who are having reduced ovarian reserve, we measure it with a parameter called anti-Mullerian hormone, where the value is less than 1.5. In those ladies, we suggest IUI is not recommended. The success rate with one attempt of IUI is almost 12 to 15%. But how many number of cycles you can do this process? So you can take maximum 3 to 4 attempts of IUI. If a couple has to conceive, they will conceive within 3 to 4 cycles. If they haven't, it's better not to continue this process, because if you continue this for more than these many cycles, the cost also becomes equal to IVF. So instead of doing more than 4 to 5 cycles of IUI, we can suggest the couple to go ahead with IVF. Many a time, if the couples are not interested in IVF, we ask them to discontinue and try naturally at home. Many a times we have seen after trying for IUI, when they try naturally, they have conceived. So many a times patient comes to us and asks, is it going to be a painful procedure? I want you to know that IUI is absolutely painless. You can resume your work the very same day after the procedure, continue with your regular activities. There is no need for anything, bed rest or anything. Success becomes more if the couple has intercourse as well on the same consecutive days. That brings the success rate even better. So I encourage all of you watching our video, if you have any more queries regarding IUI, please visit our Altius Hospitals. We have a demo. We will explain it to you in detail, and this is a very easy and painless procedure for you to conceive.